Treatment options for high blood pressure. A number of factors help your doctor determine the best treatment option for you. These factors include which type of hypertension you have and what causes have been identified. Primary hypertension treatment options. If your doctor diagnoses you with primary hypertension, lifestyle changes may help reduce your high blood pressure. If lifestyle changes alone aren't enough, or if they stop being effective, your doctor may prescribe medication. Secondary hypertension treatment options. If your doctor discovers an underlying issue causing your hypertension, treatment will focus on that other condition. For example, if a medicine you've started taking is causing increased blood pressure, your doctor will try other medicines that don't have this side effect. Sometimes, hypertension is persistent despite treatment for the underlying cause. In this case, your doctor may work with you to develop lifestyle changes and prescribe medications to help reduce your blood pressure. Treatment plans for hypertension often evolve. What worked at first may become less useful over time. Your doctor will continue to work with you to refine your treatment. Medication for high blood pressure. Many people go through a trial and error phase with blood pressure medications. You may need to try different medicines until you find one or a combination of medications that work for you. Some of the medications used to treat hypertension include beta blockers. Beta blockers make your heart beat slower and with less force. This reduces the amount of blood pumped through your arteries with each beat, which lowers blood pressure. It also blocks certain hormones in your body that can raise your blood pressure. Diuretics. High sodium levels and excess fluid in your body can increase blood pressure. Diuretics, also called water pills, help your kidneys remove excess sodium from your body. As the sodium leaves, extra fluid in your bloodstream moves into your urine, which helps lower your blood pressure. ACE inhibitors. Angiotensin is a chemical that causes blood vessels and artery walls to tighten and narrow. ACE, angiotensin converting enzyme, inhibitors prevent the body from producing as much of this chemical. This helps blood vessels relax and reduces blood pressure. Angiotensin II receptor blockers, ARBs. While ACE inhibitors aim to stop the creation of angiotensin, ARBs block angiotensin from binding with receptors. Without the chemical, blood vessels won't tighten. That helps relax vessels and lower blood pressure. Calcium channel blockers. These medications block some of the calcium from entering the cardiac muscles of your heart. This leads to less forceful heartbeats and a lower blood pressure. These medicines also work in the blood vessels, causing them to relax and further lowering blood pressure. Alpha-2 agonists. This type of medication changes the nerve impulses that cause blood vessels to tighten. This helps blood vessels to relax, which reduces blood pressure. Home remedies for high blood pressure. Healthy lifestyle changes can help you control the factors that cause hypertension. Here are some of the most common home remedies. Click on the link on the description. Developing a healthy diet. A heart-healthy diet is vital for helping to reduce high blood pressure. It's also important for managing hypertension that is under control and reducing the risk of complications. These complications include heart disease, stroke, and heart attack. A heart-healthy diet emphasizes foods that include fruits, vegetables, whole grains, lean proteins like fish. Increasing physical activity. Reaching a healthy weight should include being more physically active. In addition to helping you shed pounds, exercise can help reduce stress, lower blood pressure naturally, and strengthen your cardiovascular system. Aim to get 150 minutes of moderate physical activity each week. That's about 30 minutes 5 times per week. Reaching a healthy weight. If you are overweight or obese, losing weight through a heart-healthy diet and increased physical activity can help lower your blood pressure. Managing stress. Exercise is a great way to manage stress. Other activities can also be helpful. These include meditation, deep breathing, massage, muscle relaxation, yoga or tai chi. These are all proven stress-reducing techniques. Getting adequate sleep can also help reduce stress levels. Adopting a cleaner lifestyle. If you're a smoker, try to quit. The chemicals in tobacco smoke damage the body's tissues and harden blood vessel walls. If you regularly consume too much alcohol or have an alcohol dependency, seek help to reduce the amount you drink or stop altogether. Alcohol can raise blood pressure. Dietary recommendations for people with high blood pressure. One of the easiest ways you can treat hypertension and prevent possible complications is through your diet. What you eat can go a long way toward easing or eliminating hypertension. Here are some of the most common dietary recommendations for people with hypertension. Eat less meat, more plants. A plant-based diet is an easy way to increase fiber and reduce the amount of sodium and unhealthy saturated and trans fat you take in from dairy foods and meat. Increase the number of fruits, vegetables, leafy greens, and whole grains you're eating. Instead of red meat, opt for healthier lean proteins like fish, poultry, or tofu. Reduce dietary sodium. People with hypertension and those with an increased risk for heart disease may need to keep their daily sodium intake between 1,500 mg and 2,300 mg per day. The best way to reduce sodium is to cook fresh foods more often. Avoid eating restaurant food or prepackaged foods, which are often very high in sodium. Cut back on sweets. Sugary foods and beverages contain empty calories but don't have nutritional content. If you want something sweet, try eating fresh fruit or small amounts of dark chocolate that haven't been sweetened as much with sugar. Studies suggest regularly eating dark chocolate may reduce blood pressure. High blood pressure during pregnancy. Women with hypertension can deliver healthy babies despite having the condition. But it can be dangerous to both mother and baby if it's not monitored closely and managed during the pregnancy. Women with high blood pressure are more likely to develop complications. For example, pregnant women with hypertension may experience decreased kidney function. Babies born to mothers with hypertension may have a low birth weight or be born prematurely. Some women may develop hypertension during their pregnancies. Several types of high blood pressure problems can develop. The condition often reverses itself once the baby is born. Developing hypertension during pregnancy may increase your risk for developing hypertension later in life. Preeclampsia. In some cases, pregnant women with hypertension may develop preeclampsia during their pregnancy. This condition of increased blood pressure can cause kidney and other organ complications. This can result in high protein levels in the urine, problems with liver function, fluid in the lungs, or visual problems. As this condition worsens, the risks increase for the mother and baby. Preeclampsia can lead to eclampsia, which causes seizures. High blood pressure problems in pregnancy remain an important cause of maternal death in the United States. Complications for the baby include low birth weight, early birth, and stillbirth. There is no known way to prevent preeclampsia, and the only way to treat the condition is to deliver the baby. If you develop this condition during your pregnancy, your doctor will closely monitor you for complications. What are the effects of high blood pressure on the body? Because hypertension is often a silent condition, it can cause damage to your body for years before symptoms become obvious. If hypertension isn't treated, you may face serious, even fatal, complications. Complications of hypertension include the following. Damaged arteries. Healthy arteries are flexible and strong. Blood flows freely and unobstructed through healthy arteries and vessels. Hypertension makes arteries tougher, tighter, and less elastic. This damage makes it easier for dietary fats to deposit in your arteries and restrict blood flow. This damage can lead to increased blood pressure, blockages, and, eventually, heart attack and stroke. Damaged heart. Hypertension makes your heart work too hard. The increased pressure in your blood vessels forces your heart's muscles to pump more frequently and with more force than a healthy heart should have to. This may cause an enlarged heart. An enlarged heart increases your risk for the following: heart failure, arrhythmias, sudden cardiac death, Heart attack. Damaged brain. Your brain relies on a healthy supply of oxygen-rich blood to work properly. High blood pressure can reduce your brain's supply of blood. Temporary blockages of blood flow to the brain are called transient ischemic attacks, TIAs. Significant blockages of blood flow cause brain cells to die. This is known as a stroke. Uncontrolled hypertension may also affect your memory and ability to learn, recall, speak, and reason. Treating hypertension often doesn't erase or reverse the effects of uncontrolled hypertension. It does, however, lower the risks for future problems. High blood pressure, tips for prevention. If you have risk factors for hypertension, you can take steps now to lower your risk for the condition and its complications. Add healthy foods to your diet. Slowly work your way up to eating more servings of heart-healthy plants. Aim to eat more than 7 servings of fruits and vegetables each day. Then aim to add 1 more serving per day for 2 weeks. After those 2 weeks, aim to add 1 more serving. The goal is to have 10 servings of fruits and vegetables per day. Adjust how you think of the average dinner plate. Instead of having meat and 3 sides, create a dish that uses meat as a condiment. In other words, instead of eating a steak with a side salad, eat a bigger salad and top it with a smaller portion of steak. Cut sugar. Try to incorporate fewer sugar-sweetened foods, including flavored yogurts, cereals, and sodas. Packaged foods hide unnecessary sugar, so be sure to read labels. Set weight loss goals. Instead of an arbitrary goal to lose weight, talk with your doctor about a healthy weight for you. The Centers for Disease Control and Prevention (CDC) recommends a weight loss goal of 1 to 2 pounds a week. That means starting off eating 500 calories less per day than what you normally eat. Then decide on what physical activity you can start in order to reach that goal. If exercising 5 nights a week is too hard to work into your schedule, aim for 1 more night than what you're doing right now. When that fits comfortably into your schedule, add another night. Monitor your blood pressure regularly. The best way to prevent complications and avoid problems is to catch hypertension early. You can come into your doctor's office for a blood pressure reading, or your doctor may ask you to purchase a blood pressure cuff and take readings at home. Keep a log of your blood pressure readings and take it to your regular doctor appointments. This can help your doctor see any possible problems before the condition advances. Discover natural high blood pressure solution. Click on the link in the description.